As COVID-19 cases continue to climb in Saskatchewan, it places a heavier burden on healthcare workers. Many times over the last few weeks, we've been told by high-level medical professionals that people are straight up leaving their jobs because they cannot stand the pressure anymore. Joining me now is Tracy Zambory. She's a registered nurse and the president of the Saskatchewan Union of Nurses. Thanks for being here.
Glad to be here.
Tell me, what is it like to be a nurse in Saskatchewan right now?
It's really tough. It is the hardest it's ever been in my knowledge. It is depressing. People are despondent. I'm hearing every day, just heard at a meeting at 11:15 today, that people are just not able to do this much longer. It is just getting to be too much. The expectation is it's just not doable. The situation is untenable.
I know a lot of nurses personally, and many of them have been working doubles, 16 hours at a time because of staffing shortages. People aren't even picking up the phone when schedulers call them. What does this mean for staffing levels?
We're at a crisis level. I know that from conversations, particularly with the Saskatoon emergency rooms, there's been some times when we have a roster, which means there's a baseline of 15 and there's only 7 that come on to shift. They're short 8 staff, and the emergency rooms across this province, but right now in particular Saskatoon, are just under siege. And to have less than half of the component you require to care for these extremely ill people, it's reaching a critical level. There is going to be a critical incident happen that's going to just be catastrophic if we keep this up.
What's the breaking point?
We're pretty well there. We're pretty well there. We cannot continue on like this, and it's going to mean that something very, very tragic is going to happen. And there's going to be a massive fallout from it. We can't keep this up. There has to be some give in the system.
What about contact tracing? We know that nurses were working on that the first part of the pandemic. Now the health authority asking people to contact trace for themselves. What's the impact of that?
Well, that's also going to be part of this catastrophic outcome we've got going on here. Contact tracing was the defense or offensive mechanism that we had to fight COVID. We had to be able to find out where the hot spots were and be able to deal with it from there and help understand where is COVID, how big is it. And now we have this, all of a sudden, this dereliction of duty by the leadership of this province, the leadership of the Saskatchewan Health Authority, to now place this onto the individual. It's deplorable how that's played itself out.
What do you need now?
What we need now is a service slowdown. This system has got to have some room to breathe. There needs to be some human health resources freed up in different areas that aren't near as impacted with COVID as places like the emergency room, the intensive care units, contact tracing are, to be able to give the staff there some assistance, to be able to catch up. Contact tracing was so inundated and so far behind, but to remove it and change it to an individual responsibility, that's outrageous.
Tracy, thanks so much for your time today.
Thank you.